The Ninth Bite of Christmas. I'm sure you've been present in the room when somebody enters wearing that most treasured of Christmas gifts, the garish and truly awful Christmas jersey. At any other time of the year, these monstrous pieces of knitwear are lost to the depths of the closet, but on Christmas Day we have a license to proudly walk around in a multicoloured mural of elves throwing snowballs at Rudolph, whose nose has a small LED light to make it glow. Now, I would usually put this down to harmless fun, but in looking at ways in which Christmas caused people urgent health concerns, I came across a newspaper article that references a story of a man being taken to hospital having injured his eyelid on the zip of his newly acquired Christmas jumper. So it would seem a quick look at eyelid injuries is in order, just in case. Here is Director of Clinical Training, Dr. Dave Sorrell.
When it comes to eyelid injuries, the severity or the depth of the injury is very important. Obviously, when you consider the eye as a whole, remember that the medial injuries or medial canaliculus injuries should always be referred for that tear duct injury to the ophthalmologist. For the upper and lower eyelids, it's all about the depth and contamination of the wound, I guess. If it's a full thickness or down to the tarsal plate, I would always be referring those for, again, a repair with an ophthalmologist. And then you've got the shallow line between, is it so infinitesimal that it doesn't need any repair? So maybe in a child, for instance, who's got a very small laceration of the upper eyelid, maybe just chloramphenicol ointment over that is all they need. And then you've got slightly bigger ones where life can become challenging, certainly in children. And there have been several cases where things like tissue adhesive have been used and they've glued the eyelid shut. So sometimes you'd be repairing with suture, sometimes you'd not be repairing at all. Sometimes if it's further away, you could use a glue. I try my hardest not to use an adhesive on the upper or lower eyelid unless I'm absolutely confident I can do it safely. And there's been a number of ones where I've just sort of chickened out and sent it into hospital and they've done nothing. So I think everyone has a different line what they draw. But if you're thinking this is down to the tarsal plate or full thickness or you're unsure, it's much better to refer for a second opinion. And if it's a young person and it's relatively complex, it may not be easy to do without some kind of sedation.
So in case someone pulls the wool over their eyes this Christmas, you should know what to do. We'll be back tomorrow with the 10th Bite of Christmas. I look forward to seeing you then, but for now, thanks for listening.